to Microbiology and Immunology Unit-3 Clinical Virology. 1 Game sustaining for viral inclusion bodies. Purpose: to detect cytoplasmic or nuclear inclusion bodies caused by viral infections, e.g., cytomegalovirus, herpes virus. Procedure: 1. Prepare cell smears or tissue sections on clean glass slides. 2. Fix with methanol for 5-10 minutes. 3. Rinse gently with distilled water. 4. Stain with Gamesa solution, diluted 110 in buffered water, pH 6.8, for 20-30 minutes. 5. Rinse with buffered water. 6. Air dry the slides. 7. Examine under a microscope using oil immersion. Results: interpretation. Inclusion bodies will appear dark blue or purple. Background cytoplasm stains pale blue. 2. Preparation of samples for virus culture/investigation. Sample types: throat swabs, nasal swabs, CSF, blood, stool, or biopsy tissue. Procedure: 1. Collect specimen aseptically using sterile tools. 2. Place in viral transport medium, VTM, immediately. 3. Label and store at 4 degrees Celsius if used within 48 hours or freeze at -70 degrees Celsius for longer storage. 4. Transport to the virology lab on ice or in a cold chain. 5. Inoculate onto appropriate cell lines, e.g., Vero, Hep2, MDCK, for virus isolation. 3. Demonstration of ELISA and Western blot for HIV diagnosis. A. ELISA, enzyme-linked immunosorbent assay. Purpose: screening test for HIV antibodies. Procedure overview: 1. Coat wells with HIV antigen. 2. Add patient serum. 3. Wash off unbound antibodies. 4. Add enzyme-linked secondary antibody. 5. Add substrate, e.g., TMB. 6. Color change indicates presence of antibodies. Interpretation: positive, color development, absorbance above cutoff. Negative, no color development. B. Western blot. Purpose: confirmatory test for HIV infection. Procedure overview: 1. Separate HIV proteins by SDS page. 2. Transfer to nitrocellulose membrane. 3. Incubate with patient serum. 4. Add enzyme-labeled secondary antibody. 5. Add substrate for visualization. Interpretation: positive, at least 2 of the 3 HIV bands, P24, GP41, GP120/160, present. Indeterminate/negative, absence of specific band pattern. 4. Preparation of viral transport medium, VTM. Ingredients: example VTM recipe. Hanks balanced salt solution, HBSS. Bovine serum albumin, 0.5%. Antibiotics: penicillin, streptomycin, gentamicin. Antifungals: amphotericin B. pH adjusted to 7.2-7.4. Preparation steps: 1. Sterilize by filtration, 0.22 m filter. 2. Dispense into sterile tubes. 3. Store at 28 degrees C. Storage of virus cultures: short term, less than or equal to 48 HRS 4 degrees Celsius in VTM. Long term, -70 degrees Celsius in cryovials with cryopreservative, e.g., 10% DMSO in fetal bovine serum. MCQs. 1. Which stain is commonly used to visualize viral inclusion bodies? A. Gram stain. B. Ziehl-Neelsen stain. C. Gamesa stain. D. India ink. Answer: C. 2 viral inclusion bodies can be found in the A. Cell membrane. B. Nucleus and cytoplasm. C. Cell wall. D. Mitochondria only. Answer: B. 3. Which of the following is used as a cell line for virus culture? A. E. coli. B. HeLa cells. C. Saccharomyces. D. Mycobacterium. Answer, B. 4. The ideal temperature for long-term storage of viral cultures is A. Room temperature. B. 4 degrees Celsius. C. -20 degrees Celsius. D. -70 degrees Celsius. Answer, D. 5. Which of the following is not a component of viral transport medium, VTM? A. Antibiotics. B. Fetal bovine serum. C. Sodium chloride. D. Glucose. Answer, D. 6. The primary purpose of ELISA in HIV testing is to A. Isolate the virus. B. Detect antibodies to HIV. C. Measure blood glucose. D. Detect liver enzymes. Answer, B. 7. In Western blot, HIV proteins are first separated using A. Agarose gel electrophoresis. B. SDS page. C. ELISA plate. D. Chromatography. Answer, B. 8. Western blot confirms HIV infection by detecting A. RNA. B. Whole virus. C. Antibodies to specific HIV proteins. D. Viral load. Answer, C. 9. One of the key confirmatory bands in Western blot for HIV is A. GP41. B. GP30. C. P13. D. GP24. Answer, A. 10. Which of the following is a visible outcome of a positive ELISA test? A. Band formation. B. Colony growth. C. Color change. D. Precipitation. Answer, C. 11. Which component is added in ELISA to produce color? A. Enzyme. B. Substrate. C. Antibody. D. Antigen. Answer, B. 12. Glycostain binds primarily to A. RNA. B. Glycoproteins. C. DNA. D. Lipids. Answer, C. 13. Cryopreservatives like DMSO are used to A. Stain cells. B. Prevent cell lysis. C. Prevent ice crystal formation. D. Grow bacteria. Answer, C. 14. For immediate transport of virus specimens, the temperature should be A. -70 degrees Celsius. B. 37 degrees Celsius. C. 4 degrees Celsius. D. 25 degrees Celsius. Answer, C. 15. Which of these is used to confirm HIV after a positive ELISA? A. PCR. B. Rapid test. C. Western blot. D. Hemagglutination. Answer, C. 16. Which type of microscope is used to examine glycostain slides? A. Electron microscope. B. Phase contrast microscope. C. Fluorescence microscope. D. Light microscope. Answer, D. 17. What is the principle of ELISA? A. Antigen-antibody precipitation. B. Complement fixation. C. Enzyme-linked antigen-antibody reaction. D. Immunofluorescence. Answer, C. 18. What type of sample is commonly used for HIV ELISA testing? A. Saliva. B. Skin biopsy. C. Urine. D. Serum or plasma. Answer, D. 19. Which of these is a viral inclusion body seen in rabies virus infection? A. Guarnieri bodies. B. Negri bodies. C. Cowdrey type B. D. Bowlinger bodies. Answer, B. 20. Which of the following enhances virus preservation during freezing? A. Ethanol. B. Glycerol. C. Agar. D. Toluene. Answer, B. Thank you guys. For more videos subscribe the channel and make sure to hit the bell icon to get an latest update.